Hi, my name is Dr. Marco Davila. I'm a senior member in the Department of Blood and Marrow Transplantation and Cellular Immunotherapy. And in our fight against cancer, I have developed CD33/CD123 bispecific chimeric antigen receptors. And I'm going to speak briefly about this technology that's available. So the underlying hypothesis behind these bispecific CARs is that by targeting multiple antigens for acute myeloid leukemia, this will improve both the safety as well as the efficacy of gene-engineered T-cell therapies. So the idea is that if these CARs ligate only one antigen, here A, for example, or ligate another antigen, here B, for example, it's not sufficient enough to be able to target or it's not sufficient enough to be able to activate the T cell and kill the tumor target. However, when both CARs are ligated by their respective antigens, this allows sufficient T cell activation and killing of the tumor target. So we have created bispecific CARs to target two antigens, CD33 as well as 123. We have chosen these targets because they are highly expressed on the blast of AML in patients with relapse refractory disease. And they are expressed at very low levels in progenitor bone marrow cells. And when people have looked at flow cytometric analysis of the bispecific expression of these targets, we can see they're expressed at very low levels on progenitor cells compared to blasts. So those features may allow us to be able to may allow the T cells to preferentially recognize the blast versus the progenitor bone marrow cell. So we have created these bispecific and gated CARs where we have a CD33 and 123 SAV tagged to an activation domain, a CD3 zeta activation domain. And in the same construct, we have the other partner CD33 123 SAV, but tagged to intracellular domains only, so that intracellular costimulatory domains only, so these are not able to sufficiently activate the T cell unless the CD3 zeta activation domain is activated in tandem. So we have in vitro functional analysis of 12 different AND-gated CARs that show that these have features of AND-gated discrimination for both cytotoxicity as well as cytokines. And we've demonstrated in animal models that they can mediate quite efficacious killing of an AML xenograft in immune deficient animal mice. These are measurements of BLI, which you can see here graphically, and that in these mice that have no evidence or very limited evidence of leukemia at 4 weeks after, we can see flow cytometric analysis of their bone marrow shows very, very little blast that can be detected in these mice. Very little CAR T cells as well, but this is likely due to loss of the antigen and that stimulation for CAR T cell persistence. So we are now adapting these CARs as well to natural killer cells and gamma delta T cells to see if we can further increase the efficacy as well as safety of these targets. But this is the technology, CD33, CD123 bispecific CARs. And my name again is Marco Davila, member of the Beam TCI department here at Moffitt. Thank you.